Hello, good afternoon and welcome to the Midday News.
Let the water flow. I will speak to him directly. President John Dramani Mahama. Yellow blood do.
The Midday News is live on Joy 99.7 FM, hits 103.9 FM in Accra, in Love 99.5 in Kumasi, and streaming worldwide at myjoyonline.com, X Spaces, Facebook, and YouTube. Also live in all 16 regions of Ghana by our partner stations, including Victory FM Aflao, KTU Radio in Koforidua, Radio Justice Tamale, ATL Radio in Cape Coast, and Sky Sunyani. The Midday News is supported by Petrosol Platinum Energy, energizing dreams. This afternoon, as government rolls out its major free primary healthcare policy for all Ghanaians, the health ministry says the country is facing a worsening burden of non-communicable diseases with conditions such as diabetes, hypertension, stroke, cancer, and chronic kidney diseases now accounting for nearly half of all deaths in the country.
About 42 to 45% of our mortalities are attributable to non-communicable diseases. We must begin to trace the source to prevent them from getting to the complications.
Now we hear from the health minister, who says health workers will move from house to house as Ghana adopts a more aggressive approach to tackling the growing burden of non-communicable diseases. Also this afternoon, health authorities in eastern and northeast regions compelled to treat patients with various infectious diseases in a makeshift ward as the country continues to battle emerging cases.
There are times where you have to put another infectious disease patient in the same room, putting that other patient at risk of acquiring the tuberculosis.
We're more in our latest documentary, Healing in Borrowed Spaces. And also, as Carlos Queiroz takes charge of the Black Stars, attention is now turning to how far he can lead Ghana at the 2026 FIFA World Cup, which is now just 2 months away. We break down his experience, hear from experts, and bring you fun reactions to the appointment.
To me, it's not about the coach, it's about the players.
Last time I Ghana, I so performance no minor, the performance no permanent coach.
And later in our live story on the Midday News, we'll tell you why an Arsenal fan in Uganda is suing the club for emotional distress after the club lost against Bournemouth in the English Premier League over the weekend. These and more with me, Maame Esi Nyamekye Thompson. This is Joy News, independent, fearless, and credible. Let's settle for the details. The government is beginning the rollout of its free primary healthcare program with the health ministry, warning that Ghana is facing a growing non-communicable disease crisis that requires an aggressive response. The first phase of the program targets 150 districts from today. Ahead of the rollout, Health Minister Kwabena Minta Akando on PM Express last night said government wants every Ghanaian to take full advantage of the program and seek care not only when they fall ill, but also for early screening and detection of conditions such as diabetes, hypertension, stroke, cancer, and chronic kidney disease.
And so there are these conditions who don't even show symptoms in the first place. The people are walking in the street saying, oh, me, I don't have hypertension, I don't have diabetes. Before they begin to show symptoms, you are getting stroke, you are getting kidney failure. Okay? So it is important, exceedingly important, for us to detect the diseases at its early stages or even prevent them. In the promotion aspect, you will have counseling. You will be advised on your lifestyle conditions. You understand? So for me, yes, the free aspect makes it very affordable, but it is the reset of the whole health system to move from that overly reliant on the curative aspect to include the preventive or the prevention and the promotion.
And that is actually where the strategic value of this policy is.
Yeah.
Because as I was asking earlier, if it's only about the free, then the health insurance policy tackles a large part of that. But the advantage that you're introducing is the curative, the preventive.
The preventive, it has about 3 or 4 pillars. The free is one aspect, but indeed we have the preventive and we have the curative, the promotion. And that is what we are emphasizing on.
The minister also stressed that the success of the policy will depend not only on removing cost barriers, but also taking healthcare directly to the people. He revealed that health workers will move from house to house as part of a more aggressive national response aimed at identifying cases early and reducing the growing burden of non-communicable diseases.
We'll be using our health workers, and they will be moving from house to house to take the healthcare services to the doorstep of the ordinary Ghanaian. You know, there are people who will never walk to the health center. They will tell you, I have never been sick. Oh, me, I will never go to the hospital or what have you. It is nothing to boast of. It is very important for every Ghanaian or every human being, or at one point or the other, visit the health facility for at least some routine checkups.
In fact, once a year you must do.
Exactly.
At least once a year.
At least one a year.
At some age, actually, they encourage you to do it twice.
You understand? So it is nothing to brag about. And the delivery systems, I've mentioned the health center, I've mentioned the polyclinics, I've mentioned the CHIPS compound. At some point in time, for example, if you get to some communities where it is only the community pharmacy that is the nearest or that is the most accessible, we include it. At some point in time, if it is a school, sick base, we have to convert to clinics, we will do that. And now we are introducing a container base we call health post, like a kiosk, with fully equipped at highly populated areas like markets.
Well, my colleague Hannah Dami, a member of our health desk, is with the health minister as he tours some health facilities participating in this program. She'll join us shortly with some updates, but before then, though, our head of health desk, Fred Smith, is in the studio with me with some data on NCDs, which are devastating the country as we speak. So, Fred, how deadly are NCDs?
Well, Maame Esi, we've obtained data from the WHO, which it's on non-communicable diseases, which it says account for about 74% of all deaths worldwide, and this makes them the leading cause of deaths globally. Over 3/4 of these deaths occur in low and middle income countries, such as Ghana. And the real issue is that these deaths are largely driven by preventable risk factors such as tobacco use, physical inactivity, harmful alcohol consumption, unhealthy diets, and air pollution.
Well, we also understand that they are predominant in Ghana. Which of these?
Yes, out of the top 11 causes of death per the latest data we have from the Births and Deaths Registry in 2022, 7 are NCDs. Hypertension leads with 2,573 deaths, followed by heart failure at 2,225, stroke at 1,679, diabetes at 1,578, and chronic liver disease at 1,103. Then we have cancer at 1,036 and cerebrovascular diseases at 876. To put this in context, Maame Esi, nearly 6 out of every 10 deaths among the leading causes in Ghana are from non-communicable diseases, and the WHO is estimating the rate of NCD deaths in Ghana at 47% of total deaths.
Thank you, Fred. Very serious situation there. But let's join Hannah Dami. She's on the phone lines with us. Hannah, what exactly has the minister been examining on the ground in these health facilities?
Yeah, Maame, we are on our way to some of the health facilities to see to the smooth implementation of the free primary health care. And the expectation is that the minister wants to see firsthand exactly how this will be implemented. Should there be any issues that will arise so it can be fixed? And should there be any lessons that will be picked up from there as well so they can improve on them? So once we get to the facilities and we get all the updates, we'll definitely ensure that we update our listeners.
All right, Hannah, thank you for that. Now, health authorities in the eastern and northeast regions have been compelled to treat patients with various infectious diseases in makeshift wards. When multiple infections are handled in the same room, the risk of cross-infection to patients and health workers increases significantly. Kwetenate tracks how the gap in infrastructure for treating infectious diseases is impacting healthcare in our latest documentary titled Healing in Borrowed Spaces. First excerpts from that documentary.
In many community and district hospitals, when an infectious disease breaks out, there is nowhere designated to manage the case.
The current practice is that when somebody comes with such a disease, let's say, for instance, tuberculosis, we have a very small room that we put the patient in. And there are times where you have to put another infectious disease patient in the same room, putting that other patient at risk of acquiring the tuberculosis.
But in the districts where these infectious disease centers are needed, contractors have abandoned work. Imagine treating tuberculosis, COVID-19, and Mpox patients in the same ward. Different infections, same air, same risk. That's the reality at the Nalarugus Baptist Medical Center in the Northeast region. According to the medical director, Dr. Isabella Amese, the facility had to rely on makeshift single yard.
We had to create makeshift rooms to house these people. Given that Baptist Medical Center is a big hospital, the risk is more evident if you put even one person in a ward that takes care of 40 patients at a time. So it's very important to have the center built and as quickly as possible, because we don't know when the next pandemic or epidemic will happen.
Well, public health doctor for one of the hospitals affected, the Efiankwanta Hospital, Dr. Max Olapia, says the failure in addressing the issue lies in the remit of the health ministry, maintaining the ministry is aware of the challenges.
In this era of human rights and others, there's also reduced privacy. Because maybe you have a sensitive condition, but you have to someone close to you who, under ideal conditions, is not supposed to be around you, and some of these privacy business can by comfortable. I think the ministry is very much aware. They are very much aware.
Well, let's go on the phone lines and speak to Registrar of the Health Facilities Regulatory Agency, Dr. Winfred Kolete-Ba. Thank you for your time on the Midday News. Are these facilities registered under your outfit?
Well, thank you very much. It's a bit unfortunate I didn't get the names of the facilities. And so I would want to get their names, cross-check with my licensing department and be sure they are registered and licensed by HEFRA. I think I asked for that data, but I didn't get that.
At least we know of the Efiankwanta Hospital.
Efiankwanta Regional Hospital.
Yes.
Yes, so I would have to check. I asked for the list so I can check, but I know they've been registered with us. I know they are licensed, but I cannot tell us as it now whether it has expired or not. So I will cross-check and give you a feedback.
So, I mean, these makeshift wards, which are quite dangerous because of the kind of infectious diseases they're treating, what steps are you now going to take to ensure that better regulations are put in place to ensure these health facilities treat patients under proper care?
Well, thank you very much. We've had an infection prevention protocol for all the hospitals. And time and again, as and when we are able to get there, we follow up to see if they are following the protocols. And so once you've raised this, I will send my team there immediately. We will follow up and assess the situation. And then if we have to put in some remedial measures, we will do that. But then we have protocols for them to follow. We also go there from time to time to check and be sure that they are following them. So I will do the follow-up and I will update you again later.
All right, that's Dr. Winfred Kolete-Ba. He's Registrar of the Health Facilities Regulatory Agency. Moving on, private waste collectors in Greater Kumasi are enduring a great deal of strain dumping their collected garbage at the main refuse collection point in the metropolis. The OT landfill site, long queues of tricycles are visible at the entrance of the facility, which the waste collectors attribute to the mechanical failure of some essential equipment at the site. My colleague Emmanuel Bright-Kweko joins me live from that place. So, Emmanuel, what's the situation at the landfill site?
Maame Esi, in fact, the landfill site, as we speak now, it's nearing its capacity, as the KME said. So we came to monitor the situation. In fact, we saw a long queue. There's a long queue of these private waste collectors trying to enter the facility. Some of them tell me they have to spend the night. In fact, just a man I spoke with, he explained that he came here yesterday around 6 p.m. and this is the time he's leaving, and it's 12 p.m. And so for most of them, it's a bit of drudgery and strain that they must endure all the time. In fact, they are attributing this to a mechanical failure of some essential equipment that must be used at the facility, and so for them, because these machines are not really working very well, and so it's really impacting the operations of the officials here or the waste managers here, and so most of them would have to queue up and line up for a long time. Maame Esi.
Thank you, Emmanuel, for the update. Now, the Education Minister, Haruna Idrisu, has set up a 3-member committee to investigate allegations leveled against the leadership of the Ghana Tertiary Education Commission by the University Teachers Association of Ghana. The teacher union, at a press conference on Monday, criticized the president for failing to acknowledge its petition, calling for the removal of the leadership of UTAG over alleged governance failures. It accused UTAG of taking a regulatory posture that is not creating an enabling environment for universities to thrive, including a persistent pattern of regulatory outreach. Now, unilateral directives and coercive administrative posture. The group has given the president 14 days to address its concerns or risk industrial disharmony. Professor Vera Fiado is the national president of UTAG.
And we also demand that the status quo on academic year rollover for regular teaching and non-teaching staff be maintained pending the conclusion of what we'll consider lawful, consultative, and regulatory processes. We want to close by saying that UTAG remains highly committed to constructive engagement, dialogue, and genuine reform in the public interest. We are by this press statement, however, serving notice that if appropriate actions are not taken to satisfactorily address our demands within 14 days from today, we shall, upon further consultation with our rank and file, advise ourselves accordingly.
Well, the Education Minister stepped in to address their concerns by first setting up a committee, and my colleague Gemma Apia joins me in studio with a copy of that statement. Gemma, who are the members of the committee?
So the committee, as you mentioned earlier, has 3 members. They are Deputy Education Minister Clement Apak, he is chairing the committee. Then there is Professor Katie Ojo, he's the technical advisor to the Ministry of Education, and Professor Mahama Duwejua, he is the board chairman of UTAG.
All right. So the Deputy Education Minister, I know who the committee's members are, but what is the mandate?
The committee is supposed to investigate the allegations made by UTAG and make appropriate recommendations to President Mahama to make an informed decision. In doing so, the committee is expected to invite the parties involved to appear before it, and the ministry is asking them to fully cooperate with the committee as it undertakes this assignment. Maame.
All right, thank you, Gemma. Well, UTAG has welcomed the minister's decision. The Vice President of the Union, Reverend Dr. Ebenezer Tay Amanolate, says the union expects positive feedback within the 14-day period.
Well, we issued the presser, and if the government has, I don't know whether the government instructed the minister to do so, but all we know is that the minister has put together a 3-member committee to look into the issues we have raised, and we are hoping that within 14 days we will hear something from them. As in fact, UTAG, we've had excellent working relations with the minister, and I believe that if the minister needs to talk to us like he always does, he calls, and we are always ready to go to the minister for engagement. That is what we expect from the government. We engage on these issues so that we'll have some peace in our tertiary education sector, and that is what we expect. So we expect that within the 14 days something positive will come out.
You're still listening to the Midday News here on Joy 99.7 FM, and we'll take a break. When we return, Carlos Queiroz takes charge of the Black Stars. Attention is now turning on how far he can lead Ghana at the 2026 FIFA World Cup, which is now just 2 months away. We break down his experience, hear from experts, and bring you fun reaction to the appointment.
To me, it's not about the coach, it's about the players.
Last time I Ghana, so performance no minor, basa. Inti the performance no ko anymore. Yenye no permanent coach.
When I wake up in the morning, I brush my teeth with Kale Charcoal toothpaste. This gives me confidence all day.
Anytime you meet Amma, don't be surprised I smile showing my beautiful white teeth because I don't have cavity thanks to Kale Charcoal toothpaste for its natural charcoal properties. In fact, we are like twins. I can't go without my Kale Charcoal toothpaste.
That be why I dey use Kale Charcoal toothpaste morning and night when I dey go bed safe. It dey make my teeth white when it dey comot every scent from my mouth inside. My confidence level they go up, so I dey show my 32 teeth all.
Introducing the Kale Charcoal toothpaste, formulated with activated bamboo charcoal powder, ensures whiter teeth and removes bad breath. The strong natural property of the activated bamboo charcoal removes bacteria, absorbs surface stains on our teeth caused by coffee, wines, and tobacco. Welcome, Kale Charcoal toothpaste. Kale Charcoal toothpaste, Sankofa Yenchi.
Kale, happy smile.
This advert is FDA approved.
Welcome back to the Midday News. Now, the Tema Port is deserted as aggrieved unions continue to protest over the new AI system introduced by the Ghana Revenue Authority. Joy News understands the crucial meeting between government and the affected parties yesterday ended inconclusively. The labor unions argue the proposed system could drive up costs and negatively impact livelihoods. Maintaining their concerns have not sufficiently been addressed. President of the Food and Beverages Association of Ghana, Reverend John Awuni, insists the strike remains in full force.
And it's more, if we are saying that nobody should clear anything, the AI publicat is hallucinating figures, and we will never allow it to continue to hallucinate such figures to the detriment of the business community. Government is using the AI to extort money from businesses for their own benefit. And so we have tolerated this for too long, that is about a month and more, and we are saying that the system is completely defective, it's hallucinated outrageous figures, and we will not allow it to continue. So nothing has happened at the port. The port is as dry as anything. And our members are very resolute because it's not just that leadership is essentially embarking on this for their selfish end. No, we are doing it for the betterment of the business community, which will eventually help the country. We are giving a feedback to the government that your system is absolutely defective.
Well, let's go on the phone lines now and speak to Carlos Queiroz. Carlos, so bring us to date. What's happening at the ports?
Yeah, of course, Maame. I was at the port earlier today, and usually you know that when you drive on the Harbour Road from the Tama interchange all the way to the Harbour roundabout, on a regular day you would see trailers with containers parked and all that. But that's not the picture you see around today. I've also been to the long room where usually you would see clearing agents queue up to go to the bank to make payments and all of that. That place is as empty as a cemetery, I should say. And generally, when you go to the port, like Jubilee, Golden Jubilee area, the level of activity there is very low too. So one can conclude that the strike action is really fighting hard at the port as we speak. You don't see vehicles around usually that would load containers and all that around the Golden Jubilee area. So that's the picture from the Tama port this morning.
All right, thank you very much, Carlos Queiroz there. Now, Ghana is full preparations now for the World Cup following the appointment of new Black Stars coach Carlos Queiroz 58 days to the tournament. The appointment of the 73-year-old Portuguese comes days after the sacking of Otto Addo, which puts the preparation of the team in limbo. Carlos Queiroz comes to the job as a former coach of Portugal, South Africa, Real Madrid, a former assistant to Sir Alex Ferguson at Manchester United, among others. We'll let you into all the details shortly, but first we hit the streets of Accra to know what some of you think of the appointment, and this is what you've been sharing with us.
Yeah, because we already the former coach in what the idea. Not better say a better coach. Almost a time no 80 idea. Better no idea bit.
His appointment is a better decision compared to taking the former coach to the World Cup. Ghana has a lot of talent, but the challenge has always been about coaching. So if we get a coach who would do well, we have to be happy for him. The Black Stars is what make all of us happy. If they don't perform well, it affects all of us. So let's make him permanent if he does well.
Well, let's speak to Achu Tamako. The very latest about Queiroz's experience. So, Achu, let's start with his wealth of experience. Which other teams did he coach? Achu, can you hear me? Unfortunately, we do not have Achu now, but let's speak to Nana Jiman. He is coach and sports pundit. So, Nana, looks like Coach Carlos Queiroz has some wealth of experience in his boots, except his performances at the World Cup. From where you sit, is he the man for the job in this time as we move towards the World Cup?
Well, thank you, and a good afternoon to you and all your listeners. Really, they've taken too long to appoint him, to be honest with you, because he should have probably been appointed when we failed to qualify for the African Cup of Nations. That was when the appointment should have really been made. As for his experience, yeah, he's done a lot. His World Cup potential, I think he has taken, I think it was Portugal he took to the round 16, and the rest of his attempts failed at the group stage. Nonetheless, he's probably the best coach that Ghana has appointed in its entire history. I think only Avram Grant probably comes close. I think, some say it's not the issue of coaching, some say it's not the issue of players. I say it's the issue of the Ghana Football Association, because right now they've dismissed their technical director, and so this coach should assume the role of technical director as well as the head coach. And I've heard, I don't know, it's not been confirmed to me yet, but he's on a 4-month contract, 100,000 a month, and his main objective is to get us to the quarterfinal. And for me, that demonstrates quite clearly that the coach has to work with a dysfunctional Ghana Football Association, because he's not Jesus. So he can't just come in 60 days to the World Cup, not be able to see his team play until a week prior to the World Cup commencing, and then take us to the quarterfinals. They're not being real, and they're demonstrating once again how dysfunctional they really are. They don't know what it is they're doing. They've gotten this coach appointment correct, but it should have been done a long time ago. Because in essence, you don't bring a coach in now to come and prepare you for the World Cup. Okay. You would have already done that preparation, and you would be refining everything in the lead up to the World Cup. But good appointment. He's got good experience. I think he should have been appointed on a long-term role. Of course, that will cost much more than $100,000 a month, but it is what it is. Right. I mean, you can't expect any more from a GFA that, have totally lost direction.
All right.
And quite clearly don't know what it is they're doing and what they're about.
Right. Thank you very much, Nanajiman, for that. Well, let's get back to Achu and get to know how much he's being paid. So, Achu, how much is he being offered this time around? Do we know?
Well, if you can hear me, we're told he's earning around $100,000 a month.
All right. And the wealth of experience, though, we've gotten some a bit from Nanajiman. What more can you add?
Well, he's been to 5 different World Cups, once with South Africa in 2002 with Portugal, and then twice with Iran. His best performance has been the run of 16 with Portugal in 2010 when they lost to the eventual winners, Spain. Apart from that, he also coached Egypt to the final of the AFCON in 2021, losing to Senegal. Before then, he was also the winner of the Under-20 World Cup on 2 occasions in 89 and then 1991 with Portugal. And of course, in the Champions League, he won it with Manchester United as an assistant.
All right, Achu, thank you for that update. We wish him all the best with the Black Stars. Now it takes us to the life story of the day, and Adobia is here with us. Adobia, why is an Arsenal fan in Uganda suing the club for emotional distress?
Well, Maame, this so it's been Arsenal's third defeat in 4 matches, right? And this man is just not having it. So he shared a formal notice of his intention on his social media platform, specifically X, and it reads, "I am suing Arsenal Football Club for emotional distress, among other offences. This kind of performance is unacceptable." You can see that he's a die-hard Arsenal fan, and their losses
like
are
Fred
just
Smith.
putting him off. So I'm sure Fred will back him in this suit, but I don't know. I don't think it works.
I don't think Fred, for his love of Arsenal, will sue them. He'll endure the heartbreak, but won't sue them.
I mean, it's not easy. This particular man, it took a lot for him to say
Why
what
do people even put their hearts in it? It's just a game, man.
Really?
Anyway, but I think that's what's trending.
Yeah. Well, that too. But then Ghana police is in the trends. It's worth mentioning that they have gunned down 2 armed robbers, suspected armed robbers, in the shootouts at Tema Community 6, and
right.
people are commending them in the comments.
All right. Thank you very much, Adobia, for that. That's how we end the afternoon bulletin here on Joy 99.7.